Hello, everyone. I hope you're doing well and everything is fine with you. And I hope Dr. Sire is connected. Are you there?
Yes, sir, I'm here.
All right. I can see the excitement in your voice. How are you feeling?
Yeah, I'm so excited. I'm more excited than exam.
All right. That's good. First of all, congratulations on clearing the exam. Of course, it's
Thank
not
you. Thank you
easy.
so much.
Written is not easy as well. And clearing the exam in the first attempt is definitely not very easy, and a very few number of candidates do that, and you're one of them. So
Yeah, thank you.
the reason and the purpose of this session is to help those candidates who are in this ADC journey so they can learn from your experience, from your way of preparing yourself for the exams. And yes, so that's something, that's the reason for the session. So
hmm
please explain and help and let the other candidates know your preparation strategies, how you coped up with during the exam, how you scheduled your tasks, what way was your preparation inclined towards. So please, I'll just
Okay.
let you speak now.
So first of all, I start to study on January seriously,
Mm,
and I took my exam middle of the August.
mm,
So it's like long time for me.
mhm.
Um, I studied for a long time and long hours. I can't say I didn't study and I passed exam. Um, I was working 4 days in the beginning, but last 3 days before the exam, I just work 2 or 3 days.
Mhm.
I just decrease my hours, and for the weekend or for my day offs, I did lots of technicals again and again. I was just uh, trying to do perfect works because I'm a bit perfectionist.
Mhm.
After the exam, I was thinking that I failed because my works was not perfect. But the
Mhm.
exam is not about perfect works. It's if you are good enough, you can pass. And it needs a lots of preparation, practice, practice, practice again and again. I know everybody is saying the same thing, but I think it's really important point.
Okay. All right. So you said that you prepared from January onwards, which is roughly
Yeah.
6 to 8 months preparation time that you dedicated towards
Yes.
the preparation. All right. And how did you prepare yourself? Like, of course, you did prepare. You were preparing for the 6 to 8 months, but how did you know that you're doing the right thing?
So first of all, I start with the communication part because normally I have a very low self-esteem to talk with English. I don't
Mhm.
trust my English skills. I haven't taken any lessons for English. So I focus my communication. I read all the cases 2 times
Mhm.
and then I start to practice. I don't recommend anybody to start practice with anyone else before understanding what they need to do.
Okay. All
Um,
right. Yes, please continue.
After last 5 months, I start to do technicals, but I trust my technicals because I worked as a dentist for 3.5 years. I believe I'm good at technical part, so I still did lots of preparation, but I think my communication was more important for me, so I focused more communication part.
All right. And what about the home setup? You had the home setup with you, right? So you were practicing at your home.
Yes,
So how
yes, I
much
didn't
time
take
did you
any.
dedicate?
Mhm. I didn't take any on-site course apart from your technical course. I didn't attend any courses
Mm-hmm.
except for skilled OSCE.
Mm-hmm.
For the technical, I just last 3 months I did mock tests at home.
Mm-hmm.
So one day in a week, last 3 months, one day in a week, I did like a mock, 3 hours and gap and 2 hours. I try to finish at 5 hours. So and then I find my mistakes. At for example, I did that mock on Monday.
Mm-hmm.
On the other days of the weeks, I try to improve that task. For example, my amalgam was not good on that task. I just did lots of amalgam all week. And then next Monday, I did a mock again. I checked my mistakes and I tried to improve my mistakes.
Okay, all right. So that was with the technical. And the technical
Yes,
OSCE, I believe you attended the 1 day skilled OSCE, right? To refurbish your technical
yes.
OSCE skills. So what about the communication? What did you do for that?
For the communication, I try to do lots of practice with the different peoples.
Mm-hmm.
I find lots of different friends from Facebook, from Telegram, and
Mm-hmm.
I have a couple of friends who is preparing in my clinic at the moment. So
Mm-hmm.
I work with them.
Mm-hmm.
I find a couple of not like tutors, but they are past candidates and they are
Mm-hmm.
trying to teach. I
Mm-hmm.
did a couple of sessions with them as well,
Mm-hmm.
just to increase my self-esteem, talking with the different people.
Okay, all right. And you practiced having OSCE partners, right? Like you mentioned.
Yes, yes. I had a really, really good um, study partner, who
Mm-hmm.
is one of your student as well.
Mm-hmm.
She was really good. We motivate each other, and every day, even after work, we
Mm-hmm.
did 1 or 2 cases. No matter what happens, almost every day, last 3 months,
Mm-hmm.
almost every day, we did again and again all the cases. We tried to find our mistakes, and I gave her it. So you will do these cases today, and he
Mm-hmm.
find the case
Mm-hmm.
for me.
Mm-hmm.
We just try to simulate the exam.
Okay, all right. Now, the other thing is that, of course, like you mentioned, you, of course, were part of our complete course as well. You were with us during the written exam as well. What would you
Mhm.
say, like to say to candidates and people in general who are looking for the ADC practical exam? What input do you have in regards to the courses? Because you will see candidates attending multiple courses, long duration courses, spending thousands of dollars. So what input in regards to your experience would you like to say?
So, for the technical, if you can find your own mistakes, because sometimes when we send a picture might be not clear, but still good to send a picture. Always having a feedback from your side, it's
Mm.
very good. I'm not saying don't send a picture, but if you are not confident, you might need. But I was confident with my technical, and your videos was very good. Like because there's very good points in your videos which I don't know, and I learned from your technical videos, and they are not long. It's the important point, because I am not able to listen for an hours and hours, because I know lots of tutors. They are
Mhm.
just giving long hours lessons, and it's not necessary for me. I
Mhm.
think for all of us, we just need to practice. We know everything. We passed part one. We
Yes,
don't
the
need
thing
lots of
is that
information.
the thing with me especially and the other mentors I have or used to have is that we try to treat the candidate as a dentist because all of you, including you yourself, you're dentist. Of course, you have cleared the practical exam. You have got a license to practice in Australia. But everyone who's enrolled in our courses, whether it's written exam and practical exam, you should consider yourself as a dentist first. You're not a student.
Yes.
You're not learning a business. That's the most important thing because if you don't have the confidence in yourself, if you let the other person treat you like a student, like a beginner, then it will be very
Yes.
hard for you to climb the stairs. You need to have that confidence in yourself. Of course, the exam is hard. There are pitfalls as well. Of course, ups and downs do happen, but you need to have that confidence in yourself that yes, even if the exam is hard, I can do it because every year around 150, 200 candidates clear the practical exam. So if they can do it, you should be one of them, right? They are not special. They are not multi-talented. They're just like all the other candidates who are appearing for the practical exam. All right. So that's the
Yes.
most important thing that you need to learn, that you need to make sure that no one treats you like a beginner or a student. All right. Because you are a dentist, you are well equipped. We have some candidates who are specialists as well in different fields. So my priority is always to make sure that they are treated like a dentist and they just get the confidence, because it's a licensing exam. It's not a degree exam. You don't need to learn dentistry from start or scratch. You just need to master your skills in ways where the ADC expects you to master. All right. Okay. Now,
Yes.
anything else that you would like to give your inputs in regards to the preparation? Anything else before I speak to you
Um,
in regards to the exam itself?
Apart from technical and communication studying, I watch some videos from YouTube just to
Mhm.
motivate myself
Mhm.
and how to control my stress during the exam because I'm really nervous people. I
Mhm.
know when I go to the communication rooms, I will get excited. My hands get shaky. I'm not gonna able to talk. So this is very important point for me, how to control that. So I watch a couple of videos from YouTube and
Mhm.
I try to learn how can I control my stress. And it's really important point because you are a dentist in that room. They are patient, they are not an examiner. They are patient, you are a dentist. It's very important point.
Okay, all right. Thank you for that. Now, coming on to the exam day itself, the 2 days of the exam, how would you say, like candidates sometimes say that the examiners are rude and the exam environment itself is very stressful. They have created an environment to fail you. So, what would you like to say in regards to that?
Um, I don't think they are creating an environment to fail us,
Mm-hmm.
but they are just creating an environment they want to handle with some situation. So we need to handle with some situations. On one of the cases, can get angry. You have to handle with that, which I also experienced it.
Mm-hmm.
So when I was talking, patient was repeating everything what I said, and I have to handle with that.
Okay, all
Um,
right. And what
they are
about
not
the
trying to fail us, but there was they just sometimes behaving different.
they try to manipulate the behavior of the patient, right? Like you will have in your
Hmm.
practice, because not all patients that you have in your practice, no matter which part of the world you're working in, will not have a same attitude, right? Sometimes the patient will be
Yes,
rude, or sometimes the patient will be angry. They might have other things in their mind. They might not speak to you properly. So this, whenever they try to simulate this environment, they try to simulate the behavior of the patient in real life scenario, and they are preparing you for that. So when an examiner
yes,
is rude, or he's repeating, or he's not interested or listening to you properly, that does not mean that you will fail the case. All right. They're just checking how
yes,
you approach the case, because once you get the license, that means that you are ready to practice in Australia, right? So they are in technical preparing you for that practice. And you have worked as an assistant, like you mentioned. You might have seen patients of different backgrounds, different attitudes, different behaviors. So that is what the ADC is trying to prepare you for, because you will see candidates
hmm,
on Facebook and different social media saying my examiner was rude, so that's why I failed. No, that's not the reason. Examiners will be rude, but they're trying to see your approach on how you manage that rudeness, how you try to get the patient back to the case, how you need to make sure that the patient understands what you're saying. All right. Okay.
mm.
Now, what
And
about the, yeah, yeah.
it was not just for me. If they are rude for everyone, if they are rude for everyone, if they are angry, they're angry for everyone. It's not personal. Nothing is personal
Of
in the
course,
exam.
yeah, because they have to make sure that the candidates receive fair treatment. So it's not possible that they will be rude for you and they'll not be rude for the
Yeah,
other candidates on the same day. They will be having the same approach. All right. And
yeah,
because they have a sheet with them, whatever questions they ask, you might have noticed that they have a sheet that they are referring to,
yeah.
especially in the communication OSCE. So this sheet is given to them by ADC. So even the examiners, although they do act independently, they still have to follow what the ADC gives them. So every examiner has a sheet with them, which is not the marking sheet. The sheet contains questions, the behavior that the examiner needs to behave with the candidate. So that's what they have to make sure that it is the same for every candidate on that day of the exam. All right. Okay. Now, what
Mhm.
about the technical day? The technical day where you perform the 6 tasks on the mannequin. How did you find it?
On technical day, everything goes wrong for me.
Okay.
I drop I drop lots of things. I got so nervous. I normally I'm more confident for technical, but I was too relaxed on communication day. I got so nervous on technical day. And but I managed to pass all the tasks. But I dropped lots of things. I called the examiner a couple of times, and examiner was smiling to me, and I was just feel weird. I don't know what to do.
Okay, that
But
might have
just
put you in a lot of stress, right?
yes, yes. I drop high speed.
The thing
It
is that
was weird.
again, dropping instruments, dropping things is not something that you are judged on. How you manage
Yes.
that, that's what you're judged on. Because in real life scenario as well, you will see sometimes the mouth mirror drops or the handpiece drops. So it's normal life scenario. This is not something
Mm.
that is going to mark you down, or this is not particularly part of the marking rubrics as well. But yes, it will be a part of the infection control. So they're just trying to see how you manage, because dropping things does happen in real life scenarios as well. You drop things, you drop instruments, you drop materials, so that's perfectly fine. But the way you manage it, because you have to raise your hand, call the examiner and tell them this happened, they will ask you what will you do in your real life scenario. So you have to be prepared to answer that. As long as you're giving the correct answer, as long as the examiner is happy on how you are going to deal with if this happens in real life scenario, that is what is most important. With respect to the task, the mannequin, the teeth, how did you find it? Like, did you find it similar to the way that you were practicing during the home setup?
Yes, it was definitely same. There's no difference.
Okay.
Just the endo teeth was quite different, but
Mhm.
we are not able to find the exact ADC tooth, so it's still
Yes,
very
because the
quite
One
similar.
Dental makes or manufactures these teeth specifically for ADC. So sometimes you will have not an exactly same tooth like you will be practicing on, which you purchase from One Dental or Nevada.
Mhm.
But the ultimate thing is that you need to know what marking rubrics to satisfy. So it does not really make a difference which type of tooth you get. If you know what you need to do, if you know the marking rubrics, what points are considered in the marking rubrics, that is more than fine. All right.
Yes,
How
I
about the
think so. It
technical?
doesn't change anything.
Yeah. How about the
How about the
technical OSCEs?
technical OSCEs was not good for me. I failed from two of them.
Mm-hmm.
I
Why?
think it was because of me.
Mm-hmm.
Um, because I didn't prepare myself for skilled OSCEs enough.
Mm-hmm.
Um, I just went to 1 day course,
Mm-hmm.
2 days, 2 weeks before my exam. I don't know. I didn't practice enough.
But
I should
because
have
the
practiced
technical
more.
OSCEs, they are part of cluster 3, right? Which is 6
Yes,
tasks are judged. So you have the highest margin of error. Now, as she's mentioning that she failed 2 technical OSCEs but still managed to pass the exam. So that means you must have done brilliantly well in the remaining 4 stations, which you passed, so that you compensated for your average performance in the technical OSCEs which you failed. But at the end of the day, it does
yes.
make a difference as long as you're passing the cluster. That's the most important thing. All right. Okay,
Yes.
so my last question to you would be that, of course, as you know as well, that the passing percentage for both the written and the practical exam, especially the practical
Mhm.
exam, is pretty low, right? Roughly around 10 to 12%. So what is that that sets apart a pass and a fail candidate?
I think just to be relaxed during the exam, just self-esteem is really important. Just behave, increase your voice. Not, I'm not saying yell at them, but just don't, just talk with loudly. Just to show them I'm a dentist, you are a patient. I'm talking with you. I'm telling what we can do now. I'm giving you an options. Just self-confidence is very important.
Of course, with preparation. So some candidates will say that luck matters. Now, luck does matter, of course, because things can go, uh, in a bad way, especially for certain tasks like provisional or things like that. You might have a bad luck, but with preparation, you can compensate for bad luck. All right. So it's
Yes,
always, yeah.
I had an open contact with my provisional,
Hmm.
and then I just try to fix my fix with Flowable.
Mm-hmm.
I try my best.
And you passed the station?
Yeah.
Okay. So that's what the thing is, that candidates, because the passing percentage is so low, the candidates sometimes believe that luck is a factor. Now, of course, luck does play a part. Sometimes you will have a beautiful provisional made in first go. Sometimes you have to struggle and make it twice or thrice, right? So that does not make a difference as long as you are having an outcome, which is what the ADC expects according to its marking rubrics. That's the most important, right? So I think I have shared this quote many times, that what looks like talent is often careful preparation, and what looks like skill is often persistent revision. So that's the most important thing that you need to remember, that preparation, starting your preparation, making sure that you are well versed with all the tasks and the station of the exam, practice repeatedly and repeatedly and repeatedly. That's the most important thing, because you need to make sure that you have achieved these things before going to the exam. For example, if you're not able to do a proper ground preparation before going to the exam, there is no way that you're going to do it properly in the exam. You need to make sure that you practice in a way where you have achieved the marking rubrics at home, so that in the exam you can replicate it. Because in the exam, you don't have things or time, in fact, to practice new things or do new things. You have to just repeat what you have been learning and practicing all these months while you're practicing for this exam. All right. Any last minute tips for future candidates who are planning to go for the exam in the upcoming months and the early 2025?
So whatever happens during the exam, don't think about this. Just keep going, do your best. Don't think about what is happened, just keep going.
All right, that's fine. We any questions anyone would like to ask? So we have one question: where do we put our loop light battery, which is connected in the pants pocket, or we can clip it on our shirt? Can we carry a clip? Do you have an answer for this?
So during the technical day, they said you can put your loops first, and then you can wash your hands and you can start the exam. You can do all the other things. So I comfortably put my battery to my pocket under the gown. And then I washed my hands. I put my mask, but the examiner needs to say that.
Okay,
Otherwise,
so you mean that you removed the wiring of the loops through your neck, right?
yes.
Yeah, because the gown does not have a mid slit, right? It just connected from the back.
No.
Yeah.
Yeah.
Okay, so you got your answer, Dr. Richa, that you can place your loop light battery in the pocket, the pants pocket. All right. And then you can move the wiring through your neck and attach it to your loops. Okay.
Yeah.
Any other question anyone would like to ask?
Hey, congrats, doctor, first of all.
Thank
Yeah,
you.
this is Tony. Yeah, I wanted to ask you for the amalgam task. Did you face any challenges with the setting time of amalgam? Because I saw certain videos where people commented for certain groups, the amalgam was setting very fast and things like that. Is it true? Did you feel anything such?
It was a quite different, that I can say, but I don't know why the difference is happening. I think because of the room temperature, it might be, I'm not sure. It was a quite getting hard easily than normal.
Okay, but a
But
little bit faster than
it's
normal, isn't it?
just a little bit, not
Okay,
not extremely.
not terribly bad. Okay, thank you for that.
No, yeah.
Okay, and second thing I wanted to ask you.
Yeah, I'll just add a comment to this, is that sometimes the amalgam might set quickly, right? So if you do have problem, like for example, you mix the amalgam and you brought back to the practice table, and then when you're condensing, you feel that it's already set. So you can just discard that. All right. You can use a new capsule and mix it. All right. So you can do that. Don't worry about it, because you cannot carve a set amalgam, right? So make your life easier if you get the opportunity, although you will not, of course, because usually it will be fine. You will have a few minutes to do that. But in case that you have been in a situation where the amalgam is, you feel that it's going to set when you're done condensing and you don't have any time to carve, it's better to just discard that capsule and then mix a new capsule, because there is unlimited supply of capsules. You don't have any restrictions. And then secondly, even when you go to the common bay to collect the amalgam capsules, you are going with gloved hands. So you are not wasting any time technically. All right. Yes, Dr. Tony, you can carry with your second question.
Okay, the second one is for the composite task. If at all you had the anterior tooth, I don't know what doctor had for the exam. Did you use flowable or did you use packable? Because will they mark you down by any chance for using flowable composites for the anterior tooth?
I don't know. I haven't got anterior tooth, and I have
Okay,
premolars, and
okay,
I didn't use flowable.
okay, okay.
Okay, Dr. Tony, to answer
Okay.
your this question, you can perfectly use flowable composite for anterior. I did that. Okay.
Mhm,
And there is no
mhm.
one going to mark you down for that. Okay. As long
Okay,
as your
okay,
outcome
okay,
is according to the ADC marking rubrics.
okay, okay.
They
Because that
have the
really saves a
flowable.
lot of time for anterior composites. Yep, yep.
No, that's not what, don't listen to people, listen to what the ADC
Okay,
says. And you
get it,
have a
get it, get
flowable composite in a barrier sleeve on your bracket table.
it. Mhm.
Okay.
Okay, okay, okay. Thank you for that. Thank you.
Which tooth did you get for amalgam? Which communication
Oh,
officer did you
sorry.
get? Which tooth you got for endo task? How different the scenarios were there? How different the scenarios were from those we have in the portal? Which set did you get, Dr. Sere?
I got the gold set, and everything was the same. I can't say everything was the same. Everything.
From the cases that we have in the portal?
Yes, completely the
How did you
same.
respond after dropping the handpiece?
I said because the handpiece has a burr, so it's sharp. It's my responsible to take this out. I will take this out and I will change my gloves and I will call my DA to put a new one. And the examiner said, okay, and I continue.
Okay, all right. Any other question? I think we have the explanation of dropping instrument or handpiece in the portal as well, so you can read that. Any other question in regards to the exam?
Muhammad Mustafa. I would like to ask, like, during your practice, did you use the same teeth and the materials which ADC recommends, or did you have any other material of your choice?
I start with the eBay tooth,
Okay.
but they are very soft and they are very different from the other tooth because I feel like I wasted my time with the eBay tooth. Because when I start to practice with one dental tooth, I feel like I start from beginning.
It looks maybe new, completely different from which.
Yes.
And with regards to amalgam, it is better to practice only with this spill to ECT or with maybe the regular set and then go on to ECT. Would you recommend anything like that?
I always practice with the normal one, not ECT, but it's both of it. It's okay.
So you had been using only normal and then you practiced,
Yes,
you got an exam ECT too, right?
Because the reason the other one is cheapest one. That's the
Yeah,
reason why I
sure.
use that one.
Okay,
But
okay, fine.
you have to try with the ECT as well. It doesn't make much difference for me.
Okay, fine. Okay. The teeth which you were using were all one dental, not from Nevada.
I haven't used Novada teeth.
Okay, thank you, doctor.
Okay, now just to add to this answer, I think Dr. Muhammad asked this. If you are practicing with regular set, then you will be quite comfortable practicing with the ECT. All right. So there is no harm in practicing with the SDI regular set as well. All right. As long as you're practicing with SDI, that's the most important thing. And the reason why I suggest SDI and not any cheap Chinese capsules is because you'll get frustrated when you're practicing. The outcome of the Chinese capsules, sometimes we have that in the market. The outcome is not really nice. So you'll be frustrated that you're not being able to achieve the outcome. So always try to practice with SDI. With respect to the teeth from Nevada, you can practice on Nevada teeth. They are exactly the same, almost the same as One Dental teeth. All right. So Nevada and One Dental stock is something that you can practice your task for the ADC practical exam. All right. They're almost the same. Okay.
And doctor, okay, one more last question from my side. Would you mind telling me which tooth came in for your endodontic access cavity? Because I see that they have this 2 canal, 3 canal things going on, right? So it doesn't make
Yeah,
a
I had
difference.
two
But
six.
oh, you had 2 6.
I
Okay, okay.
Yeah, it was regular one.
Oh, thank you so much. And for the communication OSCEs, did you improvise anything to probe the ideas, concerns, and expectations of the patient, or you just followed technically the similar lines in the notes what we have, or did you
I
improvise anything?
always followed.
Okay.
No, I generally stick to the Dr. Raza's notes, but
Mhm.
I didn't memorize anything. I just
Okay.
said my sentences,
Not for the
and
memorization. Mm. Go
I
ahead,
always
doctor.
ask what is your idea to the patient,
Okay.
even for all the clusters. I stop and
Oh, you
I
did.
ask, what do you think about this? What is your idea? How do you feel
And
about
for
this
the
management? I ask these
expectations, how did you
questions.
probe that? For the expectations, how did you probe that?
For the cluster 3, I really like that question personally. If you are gonna give the management options, if you are gonna give the what you need to do, before you gave the option, you can ask about what is your expectations, and according to that, you can give the first option and then second and then the other one.
Oh, great. Okay. Okay. Thank you so much for that.
And adding to
Alright.
this answer, I think when I had sessions with you, Dr. Sere, I think you had a few sessions before your exam, right? One,
Yes.
I think half of them you had quite before, and then some close to your exam. So even you can
Yes.
see the difference, right? You see with practice, what happens is that when you're timing yourself, when you're practicing, keeping the 10 minutes time frame in mind, then you get an idea on how you need to make sure to deliver everything within 10 minutes. So that's very
Yes.
important. Of course, majority of the candidates who are enrolled in our course, they have OSCE sessions reserved with me. And that's the reason why we practice closer to the exam, is because that's the time where you need to learn the most, because you have already gone through the course portal, you have already gone through the cases that we have, but now it's time to present it, right? Going through the cases, reading them and presenting them are two different things completely, because you can have all the knowledge in the world, but if you don't know how to present it, there's no point in doing that, right? And that's one of the most important mistakes candidates make. They keep on going through textbooks and this and that, going through lengthy notes, and then when it comes time to present it, there is almost a zero response. And I have witnessed so many times these things with candidates, that when they come to presentation, they're completely blank because they don't know what to say, although they have all the knowledge in the world with them. So they have a frame set or a frame of mind which they think it's like a written exam. It's not written exam. You don't need to learn, you don't need to memorize, you need to get an idea, of course, and that's why we have these lengthy cases solved in the portal, video discussion as well. But that is just to give you an idea. In the exam, the response will be different, because the examiner is sitting in front of you. The examiner might ask you questions which you need to be prepared to answer. So make sure that those candidates who are definitely with me will have sessions, but those who are not, at least have an OSCE partner or someone who you can practice, and have a reliable partner, not just some random friend or anyone. Because if the person that you're speaking to, whether he's your friend or colleague, if they are not correcting you and not picking up your mistakes, there is no point in practicing with them, right? You need to have every session as a learning experience. All right. Are Moi teeth good to practice on? Have you practiced on Moi teeth, Dr. Sere? MOI, that guy?
Yes,
I think,
I practice with Moi teeth as well. It's same with the eBay teeth.
so they are not good.
You can start with that kind of teeth, but don't keep doing that continuously. Just have an
Because at the
idea
end
what
of
you
the
need
day,
to
if you
do.
don't get a feel of the real exam, I wouldn't suggest practicing.
Yes.
because in the exam things will be different and you are not ready to accept changes in the exam. Like I mentioned a few minutes earlier, you have to replicate your home practice almost in the same way as you practice or will be doing the task in the exam. So if you have something that is completely new, the exam environment or the exam itself is stressful, making sure you match the rubric. So when you have things which are new, it might add to your stress level. So I personally will not recommend it. I can't comment on it because I personally always use one dental teeth. When I used to give demos, always one dental teeth. But because these new things, new people are in the market, so someone who has used it has commented. So of course, if they say that they are not good, so I will also personally say try to stay away from them because you might save a few dollars initially, but at the end of the day, you need to practice on one dental teeth, which will give you the real exam feel. All right.
Yes.
Any other question, please? Anything else that you would like to ask, Dr. Sere?
Yes. So during the communication OSCE, do we get a lot of questions from the patient side as well?
Yes, lots of,
Okay.
especially with some particular cases.
Yeah.
In 2 cases, they haven't asked any questions to me. They just listen. And one of the examiner was just yawning, not listening to me. And I was just talking, and checking with the patient, trying to check, did you understand? Is everything fine? But on the other side, a couple of cases, they continuously asking the questions. So they're just checking. So you are going to do that. Why? Why? They are just continuously asking why.
Okay. And was it like a situation like you got panicked, or it was easy for you to, get into that and answer that? And was it like within the domain of the case? What was it presented, or
Yes,
it was like if we were asking, like we were explaining something and they're picking something else from that and asking over it?
I wasn't get panicked in the exam. I was so relaxed. I don't know why. I don't know,
No, that's
because
good.
I did lots of practice. I think because of that, I didn't get panicked. But the question that they asked, we already know that. We already know from Dr. Raza's notes. We know all the answers from his notes. To be
So
honest, I
like
haven't read any articles apart from the Dr. Raza's notes.
yes, I was actually about to ask you the question on that. So in Dr. Raza's communication OSCEs, it's well explained, but he has also provided us with some extra notes as well. Do we need to go through that as well, or just sticking to communication OSCE folder, that should be enough? Or we need to retain some extra info as well?
So what I did in the beginning of my study on January, I read all the cases once, and then I read all the notes once. And on my second read to all the cases, I correlate all the notes to the cases.
Yeah.
So for example, diabetes patients, I try to correlate with that notes. I turn back to that notes and I read it. Again, I read our notes and I just try to correlate with them.
Okay.
I didn't go back to all notes again, just once.
Okay, because that I have seen, like in all the cases we have, so there are some things out there which are pretty much common and they are repetitive. So actually, if we keep on reading that, so we get it in our mind, like that, yes, that should be the sequence, right? For the questioning.
Yes.
Okay. Okay, thank you.
Now, the thing with the all solved communication, of course, that's the most important folder, right? Because these are actual cases completely solved in patient language, and that you have a video discussion for each case as well. Now, the reason why we have the communication OSCE notes folder, which is a separate folder, is because when a candidate comes to me, for me, the candidates are at different levels, right? Some candidates are completely basic, like they have spent like 10 years in Australia without even touching dentistry, never worked as a dental assistant and everything. So for me, I have to provide the support to everyone, right? So I have to be equal and fair with everyone. That's the reason why we have the communication OSCE notes folder as well. For some candidates, of course, you might just go with the all sort OSCEs and you will pass the exam. And we had many candidates, hundreds of them who have done that, who have passed the exam. So for me, it's making sure that everyone receives the information. So I can't just say that this candidate, he's a specialist, he's practicing for 10 years, he is good at it. But I have to also provide for someone who is a new graduate or maybe out of practice for the last 10, 15 years, never practiced after their degree. So I have to provide for everyone. So the notes folder basically touch to those basics. But if you feel that your basics are fine and good, then the all salt communication OSCE folder is the main thing that you need to rely on, because that is where almost 90 to 95% of the information will be repeated on the day of the exam. All right. And the same goes for the written exam as well. You have cleared the written exam with us, and you might have felt that certain things are very basics in the written exam course as well. The reason for that is because, like I said, we have candidates from different frame of mind, different parts of the world, with different exposure to dentistry. So I need to make sure to cater to everyone. All right. Yes, please. Any other question? Yes.
Yes, actually, Dr. Raza. So on that only, so if in the communication OSCE, the main folder, if I know in which case I need to ask what kind of questions, even related to pain, that not all questions are relevant. If I know that, then I don't need to go to the notes folder, right?
Exactly.
So
You
that
don't
much,
need to.
yeah, even like for, yeah.
That
Okay.
is just to cover the basics now, because in the notes folder, you will see that we have a separate file with pain history question, swelling history question, or maybe patient taking blood thinners, what you need to do. So the notes folder is just to broaden your knowledge. But the main focus is always the all salt OSCE folder, because that is where the actual case is and how you need to implement that knowledge in an actual scenario. That's what is going to help you with that. All right.
Yeah, so related to that also in communication OSCEs, when patient is gonna question us, so it's not gonna be go out of the context, right?
It will never
So
be
like,
out of context. The examiner will question you in two circumstances. One, because they have a sheet with them given to them by ADC, they're going to ask you those questions. All right. Every examiner has a sheet with 10 questions mentioned on it. All right. Now, it depends on the examiner. They might ask you 1 or 2 questions out of that sheet, or they might ask you 5 or 6, depending upon how you're taking them. This is one way where they will ask you a question. The second way is when you are missing something which you should have conveyed. For example, you're telling them one of the treatment options is root canal treatment, and then you jump onto extraction without telling them the advantage and disadvantage of root canal. Now they will ask you, for example, doctor, do you think my pain will go away with root canal treatment that you mentioned? Now, this is basically indirectly a prompt, because you should have mentioned in the advantage of root canal treatment that the root canal treatment will take out the infected nerve, which will help you with the pain that you're having. But because you did not mention, the examiner prompted and asked you a question. So the questions are of two types. One is which they are given by ADC to ask you. The second is when they are trying to make sure that the information that you should have conveyed, you did not convey, and they asked you a question from that. So that becomes a prompt. Understood?
yes, doctor. Thank you.
Any other question, please?
Dr. Sere, again from my side, do you mind reflecting a bit on the technical OSCEs that you had, especially the ones that you faced a bit of challenge?
Sorry, could you please repeat again?
Yeah, could you please tell me a little bit about your experience with the technical OSCEs, especially the ones where you faced a bit of challenge?
Um,
Because you did mention
because
to me that,
I haven't worked as a dentist for 1.5 years. So skilled OSCEs needs a more like like a dental environment. So I didn't practice
Okay.
1.5 years. I feel like I have to practice properly, maybe more, or maybe I didn't take a course just
Okay.
before my exam. Maybe it was my mistake. I'm not sure what mistake did I do, and I don't want to
If you're
talk about skilled
comfortable,
OSCE because I couldn't pass.
okay. No, if you're comfortable, do you mind telling me the tasks which you found it a bit difficult? Only if you're comfortable.
It was not difficult. I did mistake. I
Okay,
failed from
okay,
X-ray task, but
okay.
I did
Mhm,
mistake.
mhm. And do you recall the mistake?
Yes, I did mistake.
No, can
Mhm.
you recall the mistake he's asking?
So my mistake was I put the phosphor plug on the wrong way.
Okay. Mhm,
So I realized that I changed it, and
mhm.
my ring was falling on the wrong side, and I tried to fix it, but I think it was not proper position. And I should have do settings for the X-ray. I forget to choose the adult patient,
Okay.
Mhm.
Mhm.
and I messed up with everything.
And did
I
they ask
failed.
you to expose in the station, or you are done with the settings?
I didn't. They asked me to do settings.
Okay.
I
They did not.
didn't choose the adult patient. So there's adult patient
Okay.
and child. I didn't choose the adult patient. I
I
just
get it. I
forget
get it.
about this.
But did they also have this part of exposing the X-ray in the same task, or was
No,
it
we didn't.
considered?
We didn't. Sometimes they ask about expose as well, but I haven't exposed.
Okay, okay, okay. Thank you so much for sharing that. And again, what would be the second task? I hope I'm not prodding too much into it.
Okay, it's too
No, you
funny.
can ask
I
as
failed.
many questions as you want. She's very happy today.
Okay, okay, that's good. Because I'm
I
going in
failed
for the
from.
exams in 3 weeks' time. That's why I'm a little curious to know, because even I'm going for just 1 day of technical
You're going with
course.
Dental 101, right, Dr. Tony?
Dental 101, Dental
Yeah,
101.
so you'll get time
Yeah.
to practice, but the thing is that,
Right.
sorry, Dr. Sarah, I'll
Because
just
I
add
do
to this.
all of this on a regular basis, but
No,
still
the thing is
on an
that I would
auspicious.
suggest is you see when you go to any on-site, you will have exposure to probably X-ray and CPR.
But we use the
But
same
try
X-ray
to
here, right?
practice the matrix band, the pit and fissure, the scaling task, at least at home as well. Don't
I
just
get it.
leave it over there, because majority out of 8 or 10, I think 6 or 7, you can practice at home. These things you can practice. So they are not going to teach you anything new. You have the videos with you. Just make sure
Yes,
that you
I've been
practice
doing
them.
that. The simple tasks, what I can practice
Yeah.
at home, I've
But the
been doing it
simple
once.
tasks, I'll tell you, the technical OSCEs are the easiest section of the exam, to tell you very frankly. Why it becomes difficult when you have a time frame when the clock is ticking. That's what makes
Get
it difficult. Otherwise, they are the easiest component of the practical exam. They are very
Because
reliable
sometimes
and they are
just to
very
tie a knot
repetitive.
in the
Yeah. Because in the exam, you have to do PPE and everything. So for everyone who's sitting the exam, I think I mentioned this earlier as well. When you do the pit and fissure, try to do it in the exam environment. What I mean by that is have 2 pair of gloves, have the mask, have your protective eyewear on a table or anything what you are practicing. And then imagine you have to isolate 3, 5, 3, 6, 3, 7, right? For rubber dam or let's say pit and fissure. Try to stopwatch on your mobile 10 minutes and then start doing the PP in the exact way that you will do on the day of the exam. And then remove the PP in the exact way that you will do on the exam as well. This will have a muscle memory developed. That's very important. Not many times, at least 5, 6 times each technical task, especially the rubber dam, pit and fissure, scaling, matrix band, these things, when you have a habit of repetition, it becomes easier. And candidates fail these tasks because of the stress of the environment. Like I know a lot of candidates. In fact, today the results got declared. 3 of the candidates failed. I asked them. Some said I forgot to wear protective eyewear during my technical OSCE. She was so stressed. So these things do happen.
Can happen.
In order to avoid them, make sure that you practice in an exam environment, and you can easily do that. Have a timer, have your PP on and off when you're doing the task, and then you can do that. And the remaining things like CPR or X-ray or anything, when you come for Dental 101, you will be learning them. Yes, Dr. Sarah, you can continue what you were saying.
I just failed CPR as well. Just
Why?
it was because I didn't count properly, because I was thinking about my communication task before my CPR task. I did communication. I think cluster 1. I was thinking about that. I forget the count, and then
You didn't count
I
while you
get
were
panicked.
compressing. Okay.
Yes.
All right. Okay. So yes, these things do add up, of course, but again, like you see that she did clear the exam, which means that it's not really important to clear every station, but it's important that if you're messing up one station, you need to make sure that the other stations goes really well so that it can be compensated for. Now, like you mentioned with the X-ray and the CPR, your both tasks were under par, right? They were below average. That's why you failed them, but your remaining 4 tasks were
Yes.
really good. And I would say that they would be exceptionally good for you to pass that cluster. So you might have done really well in the remaining 4 stations for you to compensate for the poor performance in the technical 2 technical OS case. All right. Any other question, please? Anything anyone would like to ask?
Hello, doctor. Congratulations first.
Thank
So
you.
did you summarize your points after taking the history in cluster 1?
Sorry, repeat
Yeah,
again,
he's saying
please.
that in cluster 1, did you summarize your points after taking the history?
I try to do that. I'm not sure that I can do or not. I don't remember clearly, but if you can do that, it's very good.
Thank you, doctor.
Right. In cluster 1, the priority is the history and the investigations. After the history, before you jump onto the investigations, if you have time, it's always good to summarize. And by summarize, it doesn't mean that you summarize everything. At least summarize the chief complaint the patient says, right? For example, if the patient says that I had pain, I was having a lot of sensitivity, and I couldn't sleep last night, when you're asking them about the pain questions. So when you finish that, you can just say that from the information that you have provided, you mentioned that you couldn't sleep last night and the pain has been there with cold. Is that correct? You understand? So this way you summarize. You can't just summarize all the points of Socrates, right? Which is the pain history. You just summarize what is brief and understandable by the examiner. All right.
So is it necessary to summarize in cluster 2 and 3? No.
In cluster 2 and 3, I wouldn't suggest. Cluster 2, the thing is that you have already some information of the patient with you, right? So it's better to summarize at least the information given to you on the screen. Like, for
Okay,
example, I'll just give you an example. Now, sometimes you will see that the case tells you that the patient went to the medical practitioner gave the medicines, and the patient had painkiller, antibiotic, let's say, right? Now, when you're asking the exact patient, you should tell that from your records, I can see that you did have a visit with your medical practitioner and they gave you some medications. Did you take them? How did you take them? Were they effective? You understood?
Okay.
So you
Yes, yes.
summarize it this way, rather than saying that, did you go to the medical practitioner? Now you already know from the case, they went. So you're just wasting time by asking them, did you go? Rather than rephrase it and ask in the way that is relevant to you. And how it is relevant? Because in the management, when you're giving them the painkiller, let's say the patient is taking ibuprofen and you're also giving them ibuprofen. The patient will say, doctor, my doctor already gave this medicine and it's not working for me. Why it is important, that question, how did you take it? Because now you will emphasize on the importance of that. It needs to be taken every 6 hourly for it to be effective.
Mhm.
You understood the correlation?
Yeah.
So this is how you correlate, right?
Yes, doctor. And the other thing is, if a patient does not want to do the smoking cessation, then how do we advise him actually?
Dr. Sere, you want to answer that?
I had that kind of question in the exam. Patient don't want to quit the smoking.
Mhm.
I just explained what happens if they don't quit the smoking, and they said, oh, "Okay, I'm interested in now." And I said what they can do to stop smoking.
Okay.
All right. Now, the thing with the smoking is that first you have to ask advice and assist, right? Now, if patient does not want to quit, you stop with advice. You don't assist.
Okay.
And by
Okay.
advice, you mean, like she said, that you advise them about the harmful effects. And you also tell them, if you change your mind, you can always come up to me and I can help you in regards to that. We can refer you to the medical practitioner. I'm going to give you some brochures that you can read. And if you change your mind, I'm always there to help you. This much is enough.
Okay. And the other question that I had is, how do you deal with the patient that wastes our time? I mean, they take time in order to reply. How do you deal with that?
Yes, Dr. Sere.
I haven't had that kind of issue.
Mhm.
They just ask questions and I answer. In just one case, it was asking about the management. I spent 9 minutes to talking about the another things. I just talk about the management for 1 minute, but I still passed because I explained everything in 1 minute about the management as well. So just focus what the question is asking. If they are just trying to distract you, just take over the question again and manage finishing, because if you don't answer the last sentences, it's not good.
Yes, doctor. But what I had doubt is, I mean, sometimes the patient may act blank. Whatever we say to them, they'll act blank. So, my question was whether we should say the same thing again or we should move to the next topic.
No, if the patient didn't understand you, you have to say the same thing again in a different way, in more simple way.
Yes. Now, sorry to interrupt, but the patient will never be blank. Like blank, what do you mean by blank?
No, they have a brief pause and then they start again. I mean, like wasting our time.
No, the thing is that I'll tell you now, first of all, when you're asking the questions, they are entitled to answer them. Okay? They are
Okay.
entitled to answer them by ADC. But now let's say you're asking the questions and the patient is trying to take you in a different direction, right? Now,
Yeah.
in that case, those situations, what you can do is you can tell the patient, I'll be happy to discuss that with you, but I would like to help you with the problem that you're facing right now, and I'd like to understand a bit more about it. Then you resume with
Okay.
your questioning. The one way. The second way is
Yeah.
that sometimes I will tell you that I think in one of the dry socket cases, the examiner was an old age patient and he kept on speaking and speaking. I think he spoke for 8.5 minutes. I'm giving you my personal experience back a few years ago. He spoke for 8.5 minutes. Like roughly, I would have said that he spoke literally for 8.5 minutes. He did not give me an opportunity to speak at all. This was my first station of the exam, I remember. But I was asking him history questions. He was answering them. Like I asked him, how is the pain? Now, instead of telling me a brief answer, he said, doctor, the pain is, it's affecting my life. I couldn't drop my kids to school because of it. I couldn't sleep last night. I wasn't able to eat. I had a wedding to attend and I was very angry and frustrated all the time. So, every question that I asked, he spoke for like literally 1.5 minutes. But at the end, he said that, okay, I feel that there is a remnant of the root left behind. What are you going to do? I said, I'll take an X-ray just to confirm if everything is fine. Did the previous dentist inform you anything like that? Who did the extraction for you? And the bell rang. And I passed that station because I knew I would pass because I covered all the history taking questions. That is the most important thing in that particular case. So don't worry if the examiner is answering your questions in a lengthy manner. They are not wasting your time, and they also know that there is a 10-minute ticker which is clicking, right? So as long as you're covering, you will know that where the case is taking you.
Yes. Thank you, doctor. Thank you so much.
But again, it will not be the same experience for everyone. Sometimes you will see, like even Dr. Sere said, two of the station, the examiner did not ask her any questions. So there will be different attitudes of the examiner, but the attitude or the questioning part of the examiner does not determine your success in the exam. How you perform, whether you are performing what the case is asking, that determines your success. All right.
Yeah. Thank you.
Anyone would like to ask any other question, please? Okay, that's fine for now. So what have you done, Dr. Sere? Have you sat your PTA for now or
I start to study
start to study what?
PT.
Okay,
I need to
PTA.
study.
Okay.
My English is not good.
Yeah. No, PTA is fine. You just need, I think, what is the requirement these days? I think 65, right?
65, yeah.
Yeah, you'll get 65. PTA is not a hard exam. You will get 65 and then you can go for the upper registration. But being in Brisbane, you can always work in the place where you were working as a dental assistant, isn't it?
Yes.
So they will give you a job. So that will be very easy for you. PT, I think you can even download the mock exams of PT from their official website. They're very helpful. I think it's like 140 or 120 USD dollars, but they're really helpful. So I would suggest that
Okay.
download them because that
Mhm.
gives you the actual way the exams are run. But it's an easy exam.
Okay.
It's not really hard. If you can clear ADC with your English communication skills, then the PTE is much easier. All right.
Dr.
Okay.
Azza,
Okay.
Yes, please.
sorry for interrupting. I had a general doubt. Is it tough in order to secure a job for an overseas dentist
No,
after clearing
no,
ADC?
no, not at all. You clear it, you come to me.
Yeah.
There are many, many vacancies available. Many vacancies.
Thank you. Thank you. Because many has
And
been
even now,
discouraging.
last time we had Dr. Shan, Dr. Parveen, if you remember, we had the exam experience session. I think it is there in the portal. Both of them have secured a job. So there are many positions available. Initially, you might have to start a bit regional, but that's just for the first few years or a year or two. And then you can, once you get exposure to the system of Australia, you gain experience, you can move around wherever you want. This is
No,
for
but my
overseas.
doubt was,
Yeah.
as I'm working in India, would they be able to sponsor me a visa? Because
Yes.
they would
You will
try
get
to
a
hire a
482 and a 491, 494, 482, and 186. So don't worry about that. Okay.
Thank you, Doc.
Once you are done, just let me know. I know a lot of practice owners here. Majority of them are Indians. I know some Australians as well. So you will get sponsorship. They are actually looking, they can't find. The situation is now this way that they can't find dentists, right? Because the local graduates, they don't really prefer as a practice owner. They want someone from overseas because they are trained and skilled in performing procedures, right? So that's why they want the overseas, and sponsorship is not really hard these days. They just need to put an advertisement for 28 days. After that, they hire an overseas candidate, right? So hopefully that
Yeah.
will not be an issue. The main issue is the ADC exam itself. And then the other pathway is the 491, which is the migration system, right? So you can apply for that as well because dentistry is on the skilled occupation list. So you do have option of 491, which usually takes time, probably a year or so. That's why majority of overseas candidates, they apply for the sponsorship migration pathway rather than the skilled migration pathway. But as a dentist, you're eligible for both.
Thank you for your insight, Dr. Azza. Thank you.
Any other
Dr.
questions?
Raza,
Yes,
Ask
please.
a question on that query, what was
Yeah.
going on.
Mhm.
How much time does it take maybe after the exams for on this visa
You see,
sponsorship?
once you're
maybe?
done with the exam, you give your PT, right? After PT, you submit your APRA online, APRA registration. APRA registration depends on your documents. If everything is in place, it will take roughly around maybe 4 to 6 weeks if everything is in place. If not, then it can take up to 2 months. Once you're done with the APRA registration, then you search for jobs, right? There are two main pathways. One is the seek.com, where you can search for jobs, or you can search on Facebook as well. But I would suggest that you can find an employer before your APRA is finalized, because then that employer will be pursuing your case, right? And then once you have the APRA registration, you can submit those documents and everything. So the pathway after that is not really hard, right? It will take time, of course, because the visa and everything does take time. Around 3 to 6 months is the time frame from the visa itself, the sponsoring visa. But at least you won't be under stress, right? Something is done. Once
Yeah.
the EDC is done, that's the main step. Once that is done, there are many.
Once the hard step is finished, then we are relaxed.
Yeah, once the practical exam is done, you have passed it, then there are many options available because Australia is a huge country, different states. Like I said, initially you might have to work in a regional area, but then with time, you will be able to move around.
Okay. Thank you so much.
All right.
Dr.
Okay.
Raza,
Yes, please.
regarding the same issue,
Mhm.
is there any role of age in securing a visa or PR?
For state nomination, I think 45 is the maximum age, but for employer nomination, there is no age.
Thank you, sir.
All right. So even if you are 48, 50, as long as the employer is willing to sponsor you, you can move to Australia. Okay, that's fine. Thank you, Dr. Sere, for your time. And
You too.
we're happy to have guided you through the written and the practical exam.
Yes, I'm very happy I met with you.
Hundreds and thousands of questions you have asked. I think in 1 year time, you have done both the exams, which is really nice. And I do wish all the other candidates the best of luck. And just believe in yourself. Of course, ups and downs happen. In these professional exams, sometimes things don't go according to the plan. So don't worry about failing the exam as well. All right. It's part of life. ADC unfortunately cannot pass everyone, but that does not mean that you stop trying. Always keep trying. And with preparation, with confidence, you all will do. All right. So that's what you have to believe in yourself. All right. Thank you so much, Dr. Sere, and wish you all the best. If you need any help again with your APRA, with documentation, I'm sure being in Australia won't be a hard problem for you. You have other colleagues and everyone, but if you do need any help in regards to that, more than welcome to message me in regards to that as well. Thank you and have a good night.
Thank you. Thank you so much.